project basically intends to assess the indirect effects of the COVID-19 pandemic on mothers, women, mothers who are attending or accessing antenatal, labor and delivery and postnatal services at Kawempe National Referral Hospital in Uganda. So basically, we would like to assess the indirect effects of the COVID-19 pandemic on access or utilization of these services in the hospital. So we are using data from the National Referral Hospital, Kawempe National Referral Hospital in Uganda, data that's collected among the women and mothers who are accessing maternal, neonatal, and child health care services at Kawempe National Referral Hospital. This will comprise data on the adverse outcomes of pregnancy, including things like maternal deaths, neonatal deaths, prematurity, stillbirth, miscarriages, preeclampsia, and hemorrhages. We're also going to use data on lockdown measures that were taken in Uganda from the start of the pandemic to date. And so therefore we'll use that to model and be able to answer our research questions. Since the start of the project, our main challenge has been the sub-granting process. The grant was awarded to MRC, UVRI, London School of Hygiene and Tropical Medicine in Uganda, with Muju Research Collaboration as a sub-grantee. However, most of the work is being carried out at Muju, and therefore implying that the MRC has to sub-grant the work to Muju Research Collaboration. And the process of realizing this sub-granting process has been quite slow, and therefore has affected getting the data or the data clerks on board and to begin the data cleaning process. Yeah, at the end of the project, we hope to particularly be able to identify service utilization and gaps that may be as a result of a pandemic in Uganda. And this information will therefore be able to help healthcare providers to decide what interventions might be necessary, such as either vaccination catch-up programs or any other programs that they might be able or might want to implement as after following a pandemic. So basically, the data that we realize this work would be able to answer such questions, such as what are the key populations that have gaps in service utilization, and who are the people that require specific, special interests or special interventions following a pandemic. Now, this data would also be utilized by government to develop policies or guidance for future pandemics. Given the challenges that we've had a bit of delays in cleaning our data, and therefore this has caused us to lag a bit behind, but we hope by March 2022, a first set of results will be available for sharing. The field of data science is using a lot of data generated from services, routine service data. And key among this is really how do we pull together these large volumes of data to inform, or how can this data be pulled together so as to be utilized to inform service delivery. The other key issue would be where are these open platforms or secure open platforms that can be used in a collaborative manner to answer key research questions that are facing humanity at the moment. So using routine data is key, and also where the open research platforms that can securely utilize our data. No, definitely no. Sharing the data or using data in that platform would help in such a way that we are learning from other, grantees or other, individuals in other settings of what are the key important, questions to answer with the kind of data we have, but also what are the key things or key considerations to make while we are answering these research questions. And the other thing is that we are able, with collaborating or sharing this data with others, we'll be able to develop or come up with solutions that are scalable to other settings. And we think this is really a very important avenue.